It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We are coming at you live from the Scottsdale Air Park Studios, Money Radio, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is your first time tuning into our show is about how our older adult population can live a healthier, happier life. How do we do this? We do this by bringing extraordinary guests to the show. And today's no different. I've got an extraordinary guest here in the studio with me. Right across from me, I've got Dr. Richard Gillespie. He is the medical director and thoracic surgeon at Honor Health. Welcome to the show.
Thanks for having me, Bob. I'm really excited to be here.
Can I call you Rich?
Oh, please do.
Please. Thank you. Thank you so much. So you are a thoracic surgeon, and this is Lung Cancer Awareness Month. There's so much that is packed into November.
Oh, November's a big month.
It is.
For sure.
It's Alzheimer's Awareness Month. It's Hospice Awareness Month. It's Family Caregiving Awareness Month. But this topic here is very near and dear to me. I just recently lost my stepmother back in March, and she had non-small cell lung cancer. And I want to learn a lot more about this. I mean, it was kind of one of these things that just popped up with a cough.
Yeah.
And then next thing you know, it led to she thought she was having a COVID symptom, and COVID test was negative. And then after that, the doctor said, we should probably do a chest x-ray. Chest x-ray led to a CT scan, then CT scans with contrast, and 7 weeks later, she passed.
Yeah, I'm sorry to hear that. Unfortunately, I think that's a common story for a lot of folks who discover that they have this disease, or one of their family members has this disease. And so, it's a good opportunity for us this month to sort of bring some education and awareness to the community. Because I think there's a lot of questions about lung cancer. I think there's a lot of myths out there that are, some are correct, some are not. But just sort of getting the word out is an important thing for us. Lung cancer awareness as an entity started about 20 years ago, actually, with basically a patient advocacy group, and it's grown into a big deal now. 20 million people a year learn something about lung cancer through that program. So
wow. And when we look at all the cancers, there's so many of them out there. Lung cancer is right up there near the top, is it not?
Yeah. So lung cancer is it's not the most common cancer, but because of the nature of how deadly it can be, it is the #1 cancer killer in the United States and worldwide. It's 25% of cancer deaths every year are related to lung cancer. And so it's an important place that we can make a difference. So it's a big deal to get the word out, like I said.
Yeah. And getting the word out, I mean, there are people that get lung cancer that never smoked.
Yeah.
Which is crazy. It's, there's this stigma that the only way you get lung cancer is if you smoke. And, the one that I remember, and I think so many remember, is the actor that played Superman, Christopher Reeves.
Yeah.
And his wife was an incredible caregiver, and here we are celebrating.
Dana Reeves, right?
Yeah,
so
Dana,
incredible person.
We're celebrating Family Caregiving Month, Awareness Month, and she was a family caregiver, and she gave up everything to take care of her husband, and literally less than 2 years after he passed, she passed.
Yeah, and I tell people routinely, I mean, smoker or non-smoker, the fact that lung cancer happens to anybody, it's not somebody's fault. It's a disease. That's an interesting topic. Christopher Reeve was a personal hero of mine. I saw him speak when I was in college after his accident, when he was promoting his book, Still Me. And that talk was inspiring, and actually what sent me down the path of going to medical school. So I still have a little picture of him and I from that.
Oh, how nice.
It was a seminal moment in my development. So an incredible family.
Well, you talked a little bit about your background, and I'd love to have our audience learn a little bit about who you are and where did you come from, and was he the impetus for you to go to medical school?
He was, as a matter of
Wow.
fact. So that was I don't know. I grew up as a Superman fan as a kid,
So
as
was
many of
I.
us did, right? So,
yeah.
but then as I learned more about him as an individual and an actor, I was sort of there was a little crossover there, and so I could say that he specifically is my hero. Not just the character that he played. I grew up in a variety of different places. My family's originally from West Virginia. My background was I lived in Texas and North Carolina quite a long time. Went to college in North Carolina and did medical school in New York.
UNC or
I was a Dookie.
You're a Dookie,
I'm not
okay.
allowed to talk about it, but yeah, it's true.
Yeah.
And then I did medical school in New York, and then training at a variety of places in Texas and North Carolina until I, sort of fully developed and was in practice by the time I was around 33.
And just out of curiosity, why thoracic surgery? I mean, you obviously had so many different ways to go in your career path.
Yeah. Well, it's funny. Like, these kinds of things are very organic, right? So, you have the right combination of mentors and experiences and that kind of thing. But when I tell people about, why, when we train, we do both heart and lung surgery. Heart disease is the #1 killer in America. Lung cancer is the #1 cancer killer in America. And I felt like I wanted to be in that field. I wanted to be taking on the biggest challenges. And so that was my, why I chose that field.
No, I love it. Absolutely. So this is the month of November.
Mm-hmm.
November 18th is the Great American Smokeout. And, talk to us just real quickly here as we wind down our first segment, smoking.
Yeah.
I mean, it just makes me crazy to see all these kids still smoking. I just pulled up here to the parking lot.
Yeah.
And the post office is right here. And as I'm getting out, there are a bunch of postal guys all outside smoking cigarettes.
Yeah. So everyone knows that smoking is bad for you. I mean, there's nobody who's going to argue that. Even the person who's lighting up in front of you knows this. What's interesting is that nobody starts smoking when they're 50. Right. So, people who, when you pick this up, you are either a teenager or you're in your 20s, and there is a whole industry behind, getting people hooked on tobacco. 34 million Americans even now are still smoking. And although we've done a great job, actually, the rates have gone down, and thus lung cancer diagnoses over the past couple of decades have started to trend down. Tobacco use is still the major factor. And if there's anything better than treating lung cancer, it's getting somebody to not get it in the first place. And so that starts with, tobacco cessation programs and that kind of thing.
And it's interesting. I mean, the warning signs are right there. I mean, I go back to growing up in the 60s and 70s, and I mean, the PACs always had that, but people were still doing that. I guess, my question to you are, what are some of the tips and tricks to the trade to really get people to really recognize that this is really bad for you? How do you get them to stop?
Yeah, I mean, I think you have to hold the industry accountable. I think warning labels on the boxes are important, but there's a lot about this that is cultural. I mean, we still have, it's hard to get people to stop, and there's new ways of entry with the vaping and this kind of thing, where people will start that because they don't think it's as bad, but then most of the teenagers that start vaping do end up using cigarettes as well. And so just have to realize that the biggest challenge is to keep people away from it from the first place.
So can you talk to us real quickly, vaping versus lighting up a cigarette? I mean, obviously Juul's always made the
Right.
news, and they got all these candy cotton type
Right.
flavors,
And now they're
grape
FDA
flavors.
approved as well, right? So that just happened. But here's the thing: they're only FDA approved. They're not saying that it's safe, but it's a method by which people who are actively using cigarettes can potentially use it to try and come off of that, much like a nicotine patch or
Right.
gum or something like that. Any other use is not recommended, and that's the problem. It's not. I'll be honest. I don't think it's even just the flavors. There's some fancy looking vaping tools. They got like little lights and they flash, and they almost like having a toy.
Right.
And all of that's about attracting kids. Like, there's nothing about that's not about trying to get somebody hooked in early.
Right. And it's about being cool.
Oh yeah.
It's totally about being cool. And I know, look, I do a lot of advocacy work here in town, and I had who is now a former senator, Senator Carter, Heather Carter, here in my studio. And one of the things that she was trying to pass is a bill for these places that are selling these vaping pens.
Yeah.
And they can't sell within, I think it was like a mile radius of a school, because, people leave the school and they congregated these, convenience stores and stuff like
Absolutely.
that. And they wanted to prevent those availabilities.
And I think those kinds of, that kind of stuff where you're really as a community making a stand, I think that stuff is important, and I do think it makes a difference.
Well, listen, we're winding down our first segment. Time goes really fast here. We got 3 more coming up, so I'm asking our listeners to stick around because we're going to talk a little bit more about the Great American Smokeout. We're going to talk about lung cancer and really how we can really draw more awareness to this and to really help make lung cancer, go away or not be as prevalent as it is today.
Absolutely.
Stick around. You're listening to Health Futures. I got Dr. Richard Gillespie here in the studio from Honor Health. He's a thoracic surgeon. We will be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Dr. Richard Gillespie here in the studio. He's the medical director and thoracic surgeon at Honor Health. And we have the Great American Smokeout coming up on November 18th, and November is Lung Cancer Awareness Month. If you missed our first segment, go up to our website at cypresshomecare.com, click on the media button, third button down is radio show. You'll catch this show and many, many more. So, Rich, when we left off, we were talking about, not only your background, but we were talking about my stepmom who got lung cancer, and we talked about, vaping and the kids, still smoking and how prevalent it is. 25% of the deaths that are happening with cancer are lung cancer. It's still,
Yeah, that's correct.
it is still a problem today, and we knew this, and we still know this, that smoking leads to cancer, and we still are dealing with this. And I would love for you to share with our listeners at least some statistics that many of them may not know about lung cancer.
Yeah, so I mean, we talk about lung cancer in non-smokers because I think it tugs the heartstrings a little bit, but by and large, it is a smoker's disease. And so what's interesting about that is that I think I mentioned this earlier, 34 million Americans are still smoking. Lung cancer.
That's about 10%.
Yeah.
I mean, we've got, 340 million people living. 10% are still smoking.
And that's a downgrade, right? So there are a lot of statistics that say the smoking rates have gone down, but we just can't quite get any lower than this right now for whatever reason. There's 240 new lung cancers, 240,000 new lung cancers diagnosed every year. There's 130,000 people who die from lung cancer, and this is just the United States. This is, it's prevalent all over the world. It is the most, one of the most deadly cancers that there is, regardless of stage. But I think there's hope too. There are things that are being done now that are changing, changing those factors and making it easier for us to make diagnoses and to intervene in a way that can improve people's lives. One of the myths that I think people have about lung cancer is that it's a death sentence. It's not. We can treat this. And the earlier that we find it, the better we're going to be able to give people, a fuller life.
So genders, I read that men who are smoking have a higher rate or higher chance of getting cancer versus females, right?
So it's funny. So if you look at the statistics back in like the 60s and 70s, men by far were smoking more, but over the 80s and 90s, women caught up. And so the lung cancer rates in women have actually increased, where the rates of lung cancer in men have decreased, just based on how much tobacco people are using. You just can't really put that down. And what's interesting about cigarette use is that it's not like, you smoked a couple of times in college and your risk is as great as, as grandma who smoked for 50 years. It's additive. So the more you smoke, the more likely you are to get lung cancer. And so, trying to figure out who is high risk, helps us to then figure out how we're gonna manage that and how we're gonna to make diagnosis.
And one of the data points I read, more than half of the people with lung cancer die within 1 year of being diagnosed. I know you said that you can live with it and get cures and be able to manage that, but one half die?
Well, 80% of the people right now, 80% of the people that we see with lung cancer are advanced stage.
Wow.
Stage 3, stage 4.
And it's kind of like my stepmother.
Exactly.
Yeah, because she had no symptoms and all of a sudden a cough.
A little bit of a cough, right? So when lung cancer is early stage, it's asymptomatic. You find it incidentally. It's something, you got into a car bump and you went to the hospital and got an x-ray to make sure everything was okay, and they saw a spot. And now we found something, right, to do something with. But if you wait for symptoms to appear, oftentimes it's too late.
What's interesting, too, as you talk about treatments, and I know this just from people that have gone through treatments, I mean, if it's isolated to one of the lungs, what's fascinating is you can remove one lung and live with one lung.
That's true. That's true. Now, you usually don't have to take out a whole one, which
you
is
can take
great.
out a partial one.
You just take out part, surgery. I tell my patients all the time, when it comes to lung cancer and all cancers, there are multiple tools in the toolbox. So surgery is a tool, chemotherapy is a tool, radiation is a tool, and what you need for your best effect is dependent on the person. So if you have an early stage lung cancer, surgery is the gold standard. If it's advanced stage, it's going to be chemotherapy and radiation in some combination. And so, it really depends on where we find you as to what recommendation you'd have for a treatment plan.
Well, it's nice to know you have all these tools in your toolbox, depending on where the cancers are and what the situation is in that one individual.
Right.
I would imagine, just like many other diagnoses, you see one, every one is very different.
Right. And, staging is important for us. And, we talk about that to patients too all the time, but like just to show you the wide range, if you're found with a stage 4 cancer, lung cancer, your risk of death is like 96% in the next 5 years. And certainly, as you say, people die within 1 year quite frequently. If you find the earliest stage 1 cancer, 92% of people are alive and well at 5 years. So for that to be the difference between 92% and 4% is a huge range, all dependent on finding the cancer early.
So real quickly for our audience and for me, obviously people talk stages.
Yeah.
And when you talk about stage 4, that means it's beyond the lungs, right? It's metastasized to other areas.
Correct. So staging is different for every cancer. You can go on a website and look up any prostate, breast, lung, colon. Each one has a different way to stage it. But for us, for lung cancer, just for broad strokes, a stage 1 lung cancer means you got a spot in the lung and that's it. A stage 2 lung cancer means maybe it's gone to a lymph node or two nearby. When it's gone sort of more extended within the chest, still stage 3, but then when it's spread throughout the body, it's stage 4. And so, that's the kind of thing that when a person has this diagnosis, their cancer doctor will sort of help them through that process and to understand like where they are and what that means.
And I think you hit the nail on the head. So many, it's asymptomatic, and by the time they discovered, I would imagine percentages of cancer patients that you have that have lung cancer, for the most part, are probably beyond stage 1 because they didn't have any symptoms.
Well, exactly so. And so we got to be able to make a difference there. Then you have to catch the cancer before it's symptomatic. So the question then is, okay, well, how do you do that? Because you can't just wait for somebody to walk in the office and say, I'd like you to check me for lung cancer. It doesn't work that way. But about 10 years ago, there was a really important study that was published in the New England Journal of Medicine, and they looked at a screening program. And that screening program is basically a CT scan of the chest that is done in people who are high risk. And by implementing this program, just by the ability to detect things that are asymptomatic, they were able to reduce lung cancer mortality for that population by 20%. just by screening. And so that's something that's been verified by multiple people the past decade. And so now lung cancer screening is a very viable program that is offered to and paid for by Medicare and all the other insurance carriers for the people who meet the criteria.
High risk. Define that for us.
So,
because yeah.
Yeah.
It is for those. I would imagine somebody that was a previous smoker or currently a smoker.
That's
right?
correct. That's exactly correct. So, but again, smoking is additive. So, high risk people have to have smoked enough to be high risk. So, we talk about in medicine someone having a number of pack years of smoking. So, what that means is if you smoke a pack of cigarettes a day for a year, that's 1 pack year. To be high risk, you have to have a 20 pack year history. So, you have to smoke a pack of cigarettes a day for 20 years. And that takes some time and some money, or half a pack for 40 or 2 packs for 10, but it's all got to equal that 20.
Right.
If you meet criteria where you've smoked a 20 pack year history and you're 50 years old or older, you meet criteria for screening.
Wow. That's incredible. And you did mention here in this segment there are some people that get lung cancer that don't smoke.
Right.
And you and I talked off the air about Christopher Reeves.
Yeah.
And I know he's, somewhat a hero of yours and a hero of mine. I mean, I was a big Superman fan. His wife, Dana, got cancer and she didn't smoke. And Christopher Reeve, as far as we know, wasn't a smoker either.
Yeah. So, but it's one of those things that, it affects a lot of people in this country. Everybody knows somebody who had lung cancer. And sometimes they were smokers, sometimes they were not. Sometimes they quit 25 years ago and they fall out of high risk, but it still happens.
Wow. Well, we're at halftime here. Halftime here at Health Futures, coming at you live from the Money Radio studios. I have got Dr. Richard Gillespie. He's a thoracic surgeon over at Honor Health. Stick around. We got 2 more segments left. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. We're here at the second half of Health Futures. If you're just tuning in, I've got Dr. Richard Gillespie. He is the medical director and thoracic surgeon at Honor Health. And we are talking about lung cancer. It is the Great American Smokeout, and that is on November 18th. And it is Lung Cancer Awareness Month. And we've covered a number of different topics in the first 2 segments. And if you've missed those, please go up to our website at cypresshomecare.com. Click on the media button. 3rd button down is radio show. And, Dr. Gillespie, and I've been calling you Rich, so thank you.
Yeah.
Rich, you grew up, and we were talking off air, and I did, with our parents smoking. And, it was something that was just something they did. My parents grew up in the 50s. It was cool to smoke cigarettes.
It was normal. I mean, that's just what people did.
My dad smoked Benson Hedges menthol, and my mother smoked the true menthol. And never did they switch. That's what they preferred. And they were at least 2 packers, sometimes a packer, but I mean, it was amazing. And you and I also talked about how we learned in school how bad smoking was.
Right.
And I would come home and I would tell my mother that. I remember I stole her carton.
Yeah.
Oh my gosh, she was so mad at me.
So angry.
So angry.
Yeah.
I took her carton of cigarettes and I'm like, you can't smoke these because these are going to kill you.
Yeah, I think I recall my dad's brand bringing like Vanguard or something like that. It had a little target on the pack. It was real shiny. But I remember being in kindergarten and seeing a Wizard of Oz themed cartoon, you shouldn't smoke. And I as a kid I took it to heart, and I came home and I demanded that my parents stop, and they didn't. Not at first, right? But after some cajoling, from us, I think, eventually it stuck. And my parents, are alive and well and have been non-smokers for 30 plus years now, right? And so that's how you intervene.
Right.
And
and both my parents did stop. My mother stopped after she had her first heart attack. And you know what? The heart issues that she had later in life, and she's been gone for 19 years, totally attributed to smoking.
Yep.
I mean, she smoked a lot. I mean, I remember she'd wake up in the morning, she'd light up, and sometimes do it right in bed and have a cup of coffee. I mean, a cigarette and coffee. It's crazy. I mean, I'm sure you've watched the show Mad Men, or if you've not, you've heard about it.
Oh, yeah.
I mean, watching that show and seeing those people interact, I mean, like, that's the generation my folks lived in. Smoking was cool, and they smoked and drank, and gosh, only if they knew.
Yeah. And so, but now we do.
Yeah.
And it's still a struggle, right? So it's a powerful addiction. So, trying to get people to quit is a big deal for us. But.
So, I want to delve into what are some of the signs and symptoms. We talked about the screening process,
Yep.
and you might want to give us, a little bit more info on the screening process. But, I talked about my mother-in-law. She really didn't, our stepmother, she didn't really have symptoms until that little cough. But what are some of the signs that we can really look for, or listeners can look for?
Yeah. So, we like to find lung cancer very small when maybe there are not symptoms, but there certainly are a few that people should be aware of. So, you brought up a cough. I think that's a good one. So, if you're older, if you're in your 60s, lung cancer average age diagnosis is 70, but almost all of them happen 65 years and older. We see some folks younger, but that's just the generality. So if you're of age, and you develop any kind of real respiratory symptoms, so a cough, bringing up a lot of thick, sputum. Sometimes you can get some pain associated, like on the side of your chest, not down in the middle, the way that you talk about like heart pain, but like chest pain other places. One of the most distressing ones is that people can cough up blood. That should never be ignored, right? Don't think that that's just because you had a really rough night the other night. You should have somebody take a look at that, right?
That pain, is that very similar to like pleurisy?
Yeah, it's exactly what it's like.
Because I've had that before, and that is really
it's rough,
painful. Oh,
right? Yeah. So
yeah.
any inflammation like in that lung cavity, that's pleurisy, and lung cancer mimics that very closely. So,
wow. I mean, you have to look for those signs, and the other thing is, I find. Look, you need to get in to see your PCP, and you but every so often they'll order a chest X-ray. I mean, it's just part of the physical, and I would imagine that's one of the ways to find early detection.
The best advice I could ever give anybody about health is have a doctor. I have so many friends that still don't have a primary care physician.
Wow.
You should see your doctor once a year, and have conversations with them about your health. Don't just be told what to do. The whole point is to bring up your concerns. And so if you're a person who's had a smoking history, they'll have things to talk about. And they're the ones who would order your screen if you meet criteria. So if we have educated you and you believe you fit into that category and you haven't been talked to about screening, bring it up to your doctor, make an appointment, go see them, get screened, right? So, but have a doctor. And that way you have somebody who can advocate for you and monitor these things.
So you talked about it, I think it was in our second segment, some of the screening that that was approved within the last 10 years of people that are in that high risk category. Can you reiterate that for our listeners? Because there's probably so many people that are listening here that were smokers, were that pack a day for 20 years or half a pack a day for 40 years.
Right. So if you smoked a pack, if you total up your whole history, if you smoked a pack of cigarettes for 20 years, you meet high risk criteria. And the only way to fall out of that, because I think we talked about this a little bit off air, is if you quit smoking and it's been over 15 years, you have now achieved not being high risk anymore. So it makes a difference. So if you quit, eventually your risk comes down. It never drops to zero. Right. But it gets better. And so, I think it's just another good reason to try to get off the cigarettes.
And that scan that you have is not just a chest X-ray; it's like a CT scan, right?
It's we call it a low dose CT. It's when you're talking about screening somebody once a year, you want to minimize radiation that comes from X-rays, and so it is a low dose radiation X-ray, and it'll catch things. Right. So it'll catch things early and give us a chance.
So what's interesting is you and I got a chance to meet one another before the show started, and you've got 4 kids.
That's right.
And they're all in that that age range back in the 1950s and 60s when it was really cool to smoke. They're also in that age range where a lot of people are still doing that and doing it via vaping. What are your kids seeing? Obviously you're having these conversations with them. I'm just curious, because my kids are much older now.
Yeah.
What is going on? I mean, what are they doing in the schools to really educate them?
It's funny. Like I think about this all the time. I do talk to my kids about this stuff. I think it's very important to have an open conversation. And we've been talking about the dangers of smoking since they were young. Up to now, as far as I know it, they're not smoking. Although, admittedly, kids can be pretty clever, right? So who knows?
Especially with these things that they can hide.
You can't tell anymore,
you can't
right?
tell,
So
yeah.
not in the same way. So I think just having the conversations are important. It strikes me when I look at when I pick kids up from school and this kind of stuff, I think that there is less smoking sort of out there in public.
Right.
It's not the way it was when I was in high school, where I had friends that they walk out the doors from the high school and they're lighting up on school grounds before they even get in their car. Nobody even blinked about that.
Oh,
and
yeah.
they were technically underage and all
and,
that
ba-
kind of
and back in the day when I went, they weren't just lighting up cigarettes.
Oh yeah.
They were lighting up other things too.
Right. So, and I'm not sure that's changed either. But it's so that's the thing. It's like I do think it's less in public. I think that it's less cool than it used to be. I really do, actually. I think kids are there's just something about it. There's been a change, and I hope that it sticks. So, but again, the vaping thing has changed that equation a little bit, because a lot of kids really are vaping and thinking that they're never going to smoke. This is just a different kind of a thing. It's safer, but it is still a gateway. That's how the companies are really catching kids still, even in this day and age.
Wow. I mean, it's just fascinating. But you have your own little lab experiment with your kids, so you get a little different view or lens of what's going on.
Give me 5-10 years. We'll talk and find out how it all went.
Okay, for sure. Well, I know in the last segment I want to talk about the technologies and the stuff that you're doing, because you're a surgeon and you're there trying to help people live and survive. Like I said earlier, I think every diagnosis is very different. So, what you see one lung cancer patient, you see one. So I want to delve into some of the techniques and procedures that you guys are doing. So
yeah,
we'll talk about that in the fourth segment. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Richard Gillespie here. He's a thoracic surgeon, medical director over at Honor Health. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. We're in our fourth segment. If you're just tuning in, I've got Dr. Richard Gillespie. He's the medical director and thoracic surgeon at Honor Health. We are talking Lung Cancer Awareness Month, and November 18th marks the Great American Smokeout. And we've covered a lot of great material, and if you've missed it, go up to our website at cypresshomecare.com, click on the media button. Third button is radio show. So, Rich, we've talked about a lot of things about lung cancer, and for me, it's just crazy that people that don't smoke get it. But if you get it, there are ways to live your life as best you can, and depending on the stages, as
right.
you shared. But I mean, the outcomes, if you catch it early enough, you can live pretty much a full life.
That's true.
And there's so much that is being done today, and I'm sure there's technology and stuff that is being tried into the future, and there might be clinical trials going on right now that you may even be participating in. So love for you to at least take this segment and really talk about the hope side.
Yeah.
If you do get this diagnosis.
So, there is a lot being done. It's actually it's an amazing field to be a part of, because there have been so many great strides, not just, even recently, but in the past 10 years, 15 years, a lot has been done. What's interesting about lung cancer is that if you are successful, if you do detect it early, it is potentially a curable disease, which people sometimes don't realize. So if I find somebody who's, early stage 1 or stage 2, the cancer team will recommend an operation for this. And so that's where that's my passion. So that's what I do. And so we've gone from the old days where, and some of your listeners may have family members that have the old-fashioned thoracotomy incisions where people got this big old incision and a rib cracking kind of an operation where you go in and that's how you take out the parts of lung. And then over the past 15 years, we've transitioned to all minimally invasive robotic technology, 8 millimeter camera incisions, these kinds of things. You could do the whole operation on the inside and then just, put that part of the lung into a bag just like a gallbladder and take it out through a small incision. And
where's that small incision done?
It's just done. It's just on the side.
So it's done, and you go under the rib cage or through it?
It goes right between. You pick someplace down below. It goes between the ribs, but you're not having to spread or crack or anything.
Wow,
and,
fascinating.
Lung surgery. It still hurts some. There's no way around that, but it's much different than it used to be. And so people are out of the hospital faster. Mortality rates are lower, survival rates are higher. So it's for us, it's been a very exciting, few years where things have changed quite a bit.
Well, it's crazy, the robotic technology. I mean, Da Vinci, everyone's heard of that. I don't know if it's the Da Vinci robots that you're using for this.
Yep, that's what we use. It's still the only company in town so far, but it looks like there are going to be some new companies coming out in the future as well.
But fascinating that, it's minimally invasive and, the cracking of the ribs, the way old school it was done. I don't know if when you did your training, you were doing that way.
So my career has basically lasted the entire time. When I first started doing surgery, everything was open.
Wow.
And then, as I sort of got more specialized, we went to just the little camera operations. And now with the robotic technology, it's, I've been fortunate to see the whole sway.
So what do you see for the future? I mean, wow, it's just fascinating what you've seen just in your practice.
Well, the thing that I see the most is that, what I'm hoping is going to be happening is that, the other things that we do, the radiation, the chemotherapy, the targeted immunotherapy stuff is going to be good enough that even people who are advanced stage may have enough improvement that then they become candidates to have their cancer removed. And so, again, we've talked about tools in the toolbox. This is all multidisciplinary. You have a team of doctors, and I compared it sometime previously to a football team. You have a surgeon who is a quarterback. You got the medical oncologist, and they're the coach making the plans. Your radiation oncologist is the kicker. Underappreciated but putting points on the board. But the patient is not a spectator. They're not in the seats. They're actually the team owner. Right. That's what they are, right? So they put their team together and they help to, they're making the big decisions about their care, and we're just trying to do what they think is best for them.
But I love that. I mean, and that's where we are going with healthcare, consumer directed. I mean, we need to be really in charge of our health, right?
Yeah, absolutely. You have to be engaged, right? So you can't just, say, whatever you say, doc, just do what you think is best. There are so many options out there now,
right?
And being educated, and that's part of what your physician's job is to educate you about, risks and what things are going to be like, and that way you can make the right decision for you.
So, Dr. Gillespie, my stepmom I shared with you had stage 4 non-small cell lung cancer, and her oncologist, which I found really fascinating, took the pathology of the nodules, if you would, and sent it to a group called, I think it's CARIS.
Yes.
And it was really fascinating to me. Now, it took a little longer than we wanted it to, but based on that, they came up with the recipe or the playbook, if you would.
Exactly.
And it involved chemotherapy and immunotherapy, and it was the right mix to really help treat her. So, I mean, that's some of the breakthroughs I would imagine is happening.
Yeah, so 5 years ago, that was not happening, right? So this is all new stuff that's coming around. So finding targeted, something about the tumor is genetically different from your normal tissue, right? So all of cancer used to be normal. It was normal you.
Right.
And now something has happened to it and it's acting abnormally. whatever it is that made it into a bad actor also makes it a target for some sort of medication. And trying to put those two things together is where all the research is right now. And it's fascinating. So, Caris and some of these other companies, you send the tumor, you get a genetic profile that basically like tells you, okay, well, these are the genes that are bad. And, if you're lucky, we've already developed a medication that affects that particular one, and thus you're a candidate for this medication. And so there's a lot of future progress there.
Well, I think the one thing I would love to see, and this is more personal for me, is that I wish they could do it faster.
Yeah.
I wish that they could come up with that, formula within days rather than weeks, because the cancer she had was really moving fast.
Yeah.
And that made it really, really hard.
Well, and I think that's true. Even now with the hopeful things that we have, lung cancer still often is a very tragic story, and I think it's gonna be that way for a while, and we just have to have the willpower and the resources to do the research that we need to do to be able to make bigger strides.
So, Rich, I think I heard you say in the third segment, I think one of the most important things for our listeners is if you don't have a doctor, get a doctor. Get in to get your physical. Part of having a physical, is having a chest x-ray done and getting examined. I mean, I think that's the beginnings, right?
Yeah, I mean, sometimes you can get away with that stuff when you're a kid, but, we're all getting older. Right. And, it's just like taking your car into the mechanic. You got to take yourself in and get checked every so often. Right. And so have a doctor is the best advice I could give anybody.
Well, it's interesting. I mean, March is actually colorectal cancer awareness month, and I always have a gastro doc here in the studio talking about it. And it's one of the most preventable cancers. All you have to do is get screened.
Right.
Right? I mean, you have to be on top of your health care. You have to be your own advocate.
Right. And so, and that's actually, thanks for reminding me, I need to schedule my colonoscopy. So, we just got to take care of the business.
You do. Well, as we wind down our show, we just have a minute or so left. Is there any lasting impressions, any questions I have not asked that you would like me to ask?
These kinds of things I think are always, always interesting. Conversations like this can be organic. And so, what I would say is, for anybody who's listening who has a question or isn't sure, if they meet criteria or something, they want more information, they are welcome to reach out either to their own physician or, to get on the Honor Health website and to educate themselves. And, our office is always a resource for anybody who needs to know more.
Rich, thank you so much for joining me here today.
Bob, it's been a pleasure. Thank you for having me.
Make it a great day. Have a great weekend. Make sure you tune in next week. We'll have another great show here on Friday, Health Futures at Money Radio Studios. If you're at risk of lung cancer or have recently been diagnosed, you can schedule an appointment with Dr. Gillespie. To learn more about your options for a screening, lung cancer treatment, or his smoking cessation program that he is working on, you can email him at lungcare@honorhealth.com or calling 480-583-9013.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.